mute, that would be very helpful. Good afternoon, everyone, and welcome to this afternoon's press conference for Friday, the 12th of February at just about 3 o'clock. Thank you, as always, for joining us. Today on the panel, we have Lucy Whiteman, our Director of Public Health, Eileen Doyle, Chief Executive Officer for Kettering General Hospital, Chris Pallow, Programme Director of the COVID-19 vaccination, Assistant Chief Constable Simon Blatchley of Northamptonshire Police, and we also have Paul Andrews from the school cell, Ashley Leduc for the Chair of Care Home Cells, Councillor Jonathan Nunn, Councillor Tom Beattie, and Councillor Martin Griffiths. The running order will be as I announced the panel. So we'll go straight to Lucy Whiteman, and then after that we will come to the submitted questions as always. We are live on YouTube today. So I'll go right now to Lucy Whiteman. Good afternoon, Lucy.
Good afternoon, Councillor Morris, and welcome everybody. Thank you for joining us once more. As always, we've got our surveillance report on the Northamptonshire County Council website, starting with some of the key headlines from the data up to the 7th of February. So obviously everybody knows we continue to be in a national lockdown, and there is significant discussion about how we will be exiting lockdown, and we expect to have further details of that, as people know, from the 22nd of February. So something I'm sure we all look forward to understanding more about. Some of the issues that we're conscious of, though, in Northamptonshire is still that some people are being tested and or vaccinated and thinking that perhaps they don't need to be adhering to those lockdown rules. They must continue to do so. Not only is it a legal requirement, but from a point of view of making sure that those who aren't able to access testing regularly or who aren't vaccinated yet obviously continued to need our protection, and therefore we must, all of us, regardless of whether we've been vaccinated or tested recently, continue to adhere to the rules. And it's by people doing that that we've got the good news that our case numbers for the week up to the 7th of February have gone down again, and we recorded 1,839 cases in that 7-day period. So that is really, really good news, and it does just demonstrate that where people are adhering to the rules, it really is making a difference. But we are still finding that transmission is mostly occurring within and between households. So again, just making sure people understand how best to keep themselves and their families safe if they identify as being positive, trying to create that distance within their own home, and obviously people adhering to the rules and not mixing with other households. And that's going to be particularly important next week when we go into half term. So if we go down to that first data page as always, please. So really good news, really, really positive graph. We've got that continued decrease in cases, and again, we've got a good rate of decrease between each week. So, we're maintaining that continued downward trend. Obviously, we still do have a much higher number of cases than we would want overall, and there is differences between, different boroughs and districts, and we will go on to that in a little bit more detail. If we go to the next slide. So here you can see the rates between the boroughs and districts, and as I said, there is a significant variation. South Northamptonshire right down at 130.2 cases per 100,000 as a rolling 7-day average, statistically significantly lower rate both than the county average but also the England average, and that's where we want all of our boroughs and districts to be. And again, as I said, that range going all the way up to Corby there at 444.5. So, a threefold increase or more on the South Northants rate. We do recognise that these are different areas. They have different people living in them who have different behaviours and have different levels of exposure and risk. So we're doing all we can to make sure that residents in Corby and other areas, particularly where people are having to still continue to go to work, know how to do that safely. And we're providing continued support and guidance to those residents. And I'm sure Tom will talk about that more later. If we go on to the next slide. So this is the actual number of cases per borough and district. So again, good news, we've got a decrease across the patch, not only at a county level, but every single borough and district. And I'm sure people will have noticed that Corby no longer has the highest rate in the country. It's now down at second place, and we want to continue to see it move down that ranking according to the Chief Medical Officer. So good news, but we've got to keep adhering and sticking to those rules if we're going to continue on this trajectory. Next slide, please. So this really does demonstrate what I'm talking about. We know that all of the bars above the line show when we've got an increase in case rates as a 7-day average, and all the bars that are below the line demonstrate that reduction in cases. And I talked a couple of weeks ago about the fact that, yes, although we were seeing a reduction, the speed at which we were reducing had really plateaued. And you can see the last couple of bars there, in fact, the last bar on that chart, demonstrating, you know, a big number from a point of view of the reduction in cases. So we're not only seeing a reduction in cases, but we're seeing a greater speed at which that is reducing at a county level, which is really, really positive news. So next slide, please. So again, really, really lovely illustration of how we've got that downward trend. You can see that there's fluctuations in each area. You can see obviously the little peak that we saw a couple of weeks ago in Corby, but broadly it is good news. We've also seen there, if you can tell, that we've got Wellingborough that's now coming down to the county average, but we still do have 4 boroughs and districts that are above the England average. And obviously that's what we need to try and catch up with and close this gap between Corby and our other boroughs and districts. If we move on. Again, same story as we've seen now for a couple of weeks, and that really does demonstrate some of the things I mentioned earlier about different demographics in different areas having different levels of exposure. We're still seeing that working age population being the age group that has the largest number of cases. And we do recognise, and indeed Councillor Beattie has raised the policy issue before, that we do have areas such as Corby, such as Northampton, where we've got more blue collar workers, we've got more manual workers who just simply cannot work from home. And therefore at a population level, we've got greater risk in some of those populations. Again, it's some of the conversations that we had with the Cabinet Office. We're making sure that we raise this as a concern, and that all of those businesses that do continue to need to operate, make sure that they're doing so safely and providing the safest possible environment for their employees to work in. If we go down. And one of the best elements of recent progress is that we've got that over 60s case rate coming down, and that has translated into this reduction that you're seeing here in confirmed beds occupied by COVID positive patients. I'll leave Eileen to talk a bit more about the hospital pressures, because obviously we still are in the middle of winter and COVID is not the only pressure on our bed base here. But, you know, I'm sure you'll see it is good news. We've had a little uptick, as people can see, in the last couple of days, and we'll be monitoring that closely. But we do recognise, again, over half term, people will potentially be using over 60s house, family members as part of their childcare bubble. And we just need to really reinforce that if indeed you don't have another option to do that, we've got resources on the County Council website that just give you tips and ideas about how to try and make that as safe as possible. And obviously trying to only maintain one childcare bubble rather than using multiple ones, because obviously that just increases risk of transmission and puts people at greater risk again. If we move on. And one of the other benefits, obviously, of seeing that case rate come down in the over 60s is we have seen a general decrease at a county level in the number of deaths. Sadly, we do still have an increased number in 2 of our boroughs and districts, but overall, the good news is these are smaller numbers. And I don't mean that to detract from the loss that anybody has experienced. I've talked before about that being, a very acute issue for me. And I'm very conscious of, 5 people in Corby and 6 people in Wellingborough still being an appalling event for anybody to have to deal with. But the good news is that we've got a downward trend generally, and we just need to make sure that that translates through to all of our boroughs and districts, so fewer and fewer people are having to deal with the tragedy of losing someone to COVID. If we go on again. So as always, we cover off the cases by community, and the next slide, cases as a rate for all of our boroughs and districts, so people can see the most affected wards. The next slide just shows the couple of areas that we've had an increase in, and people, I'm sure, will have noticed that again on that national list, Kettering has popped up. So we're making sure that we're taking, again, redoubling our efforts in Kettering to make sure that we've got all of the support that we need there. We do not want to see Kettering move up that list at all. In fact, obviously, we want to continue to see that downward trend that we've achieved in the last 7 days. So we are very conscious of the fluctuation in cases and case rates in Kettering, and are keeping a close eye on that. And indeed, environmental health officers and partners like the police are also supporting with increased numbers of patrols, etc., to make sure that people are as compliant as possible and do get any information if they continue to be confused about any of the restrictions or requirements upon them. On the next slide, please. So one of the challenges, as we've talked about before, is continued management of outbreaks. People have seen this fluctuate over a period of time. At the moment, we have still got quite a high number of outbreaks within our care home and care provider settings. So that is a challenge. And we've talked again about the complexity of some of those and the numbers of people involved in each outbreak increasing. And that is generally to do with the high transmissibility of the new Kent variant, which we know is very prevalent in Northamptonshire. But over the last 2 weeks, we have also seen an increase in those workplace outbreaks. Again, you can see specifically 3 in Corby. So some of the risks and challenges that Councillor Beattie had raised before certainly playing out there in that local environment. Again, we're making sure that we've got increased patrols from a point of view of environmental health and police to ensure that people are clear on their responsibilities, have access to help if they need it, but obviously make sure that we do have all of the support that those organisations may need. One of the other things we've obviously put in place in Corby and in Northampton is access to lateral flow device testing for those people who do have to attend work and cannot work from home. Just to remind people that all that does is tell them if they are infectious on the day of the test. It will never be able to tell people if they are COVID free, and therefore anybody who does undertake a lateral flow test, and indeed a PCR test, must continue to adhere to the rules even if they get a negative test result. So making sure that people do understand that is a beneficial supplement service, and if we find that people do abuse that, we will have to obviously review the availability of such testing. So please do be mindful. If you use lateral flow, it doesn't mean you're COVID free. If you get a negative result, you still must adhere to all the rules, and a positive lateral flow test again does require you to be isolating the same as a PCR test does. So one of the tools in our toolkit, we've got many at our disposal now. So we've got no excuse but to keep using them, keep making sure that everybody's doing everything they can, standing shoulder to shoulder on this, because it's the only way that we will get through to a point where we will be a county with all of our boroughs and districts coming out of lockdown as and when that step process is made clearer. So if I stop there, Councillor Morris.
Thank you very much, Lucy. As always, a very clear and precise report there, as always, and we mustn't be complacent, I think, is the key message. And we only have to look at those numbers of deaths that are coming down, but until they get to 0 or near 0, I don't think any of us can rest easy until we get there. And Lucy's outlined very well what we need to do to make that happen. I'm going to bring in Eileen Doyle now. Hello, Eileen, to talk about the hospitals, which Lucy did refer to in her presentation. Eileen, good afternoon as always, welcome.
Thank you, Councillor Morrison, and afternoon everybody. So both hospitals, both Northampton General and Kettering General, remain busy. As Lucy said earlier, we are in the middle of winter, and so it's not just COVID that we're dealing with, but I am pleased to say that the numbers of COVID inpatients are for another week on the trot coming down. So we have 193 positive inpatients today, of which 38 are recovered and are either waiting for transfer out or are being treated for other things as well, because of course people can come in with COVID and be having something entirely different done to them. So that's encouraging. What is less encouraging, however, is our number of patients requiring the highest level of intensive care has remained the same and is in fact slightly increased to 25 today. And so, what it's telling us is those people that get sick from COVID are really sick from COVID. And so clearly those patients are poorly and being looked after, and that's a tremendous strain on those families and in fact those individuals. So it's an improving picture, but there are elements of this picture which are still as serious as they ever were and possibly more so. We have just over 3% of our staff off with COVID or COVID-related symptoms, which out of 10,000 or so staff is not so bad. But of course, every member of staff that's out on off sick is a member of staff that's not on the front line or in support of the front line. So that's remained about the same. So we would really like to see an improvement on that. And of course, that is all to do with our own social distancing and the background of disease in the community. As you know, because I've talked about before, we moved our paediatric ward Skylark a couple of weeks ago to create more capacity for adults on the Kettering Hospital site, and also to distribute the oxygen requirement around the site. And I have to thank my paediatric colleagues for enabling that to happen, and it has definitely decompressed the pressures on adult beds across the site. But we are planning to move them back to Skylark by middle of March at the latest. And the reason why it's that a few weeks hence is because, firstly, I don't want to jump the gun, because we need a little bit more capacity in the system to make sure that we move and we don't create a pressure. But also we need to do some enabling works for estates around ventilation. So that's allowed us to have a little bit of space in the system to be able to get that work done. But that will be happening in the next couple of weeks, so mid-March at the latest. We are also trying to work out, and Northampton General have already started this, about how we vaccinate inpatients now that we have the AstraZeneca vaccine at our disposal, to be able to, for those patients in the groups that Chris will talk about in terms of vaccination, that we are catching them, those patients, as they're in our beds. It's quite a logistical exercise, but working through that. NGH have already started, KGH are intending to start. And we're also looking at other groups of patients, for example, patients undergoing chemotherapy or other adjunctive therapies for cancer, whereby they may not hit the traditional 1 to 9 groups of vulnerability, but nevertheless they're in a position in their lives whereby they don't need something on top of what they're already dealing with, like COVID. So we are trying to deploy our roving teams to make sure that those patients are looked after and that we are able to vaccinate them. It's a delicate balance, because obviously Chris will talk about what's available out in the community, and we need to be using that, because hospital sites, we're still quite strict about making sure that we don't have too much traffic and too much footfall on the sites for obvious reasons, but we are trying to be as pragmatic as we possibly can. And all I'd finally like to say, apart from thanking the staff as ever, who do a tremendous job, is also thanks to our military colleagues who leave us this weekend from 1st Battalion, the Yorkshire Regiment, who have been at both hospitals supporting with good humour and doing anything that's asked of them. They're all non-clinical, but we've had them for a few weeks and they've been a tremendous support and actually a bit of a morale boost really for the ward staff. So just our thanks to them really for coming and helping us out when we needed it. So thanks, Councillor Morris.
Thank you, Eileen, as always, and we're in awe of the work that you are all doing at your hospitals. It really is. They really are a wonderful institution in the county, and they're working extremely hard to keep us safe. So thank you very much, as always, for coming. Now I'm going to pass now to Chris Pallow, who's the Programme Director for the COVID-19 vaccinations. Chris, good afternoon.
Good afternoon. Thank you, Councillor Morris, and good afternoon, everybody. So the latest update from the vaccination programme in terms of numbers is that we have now vaccinated around 94% of our over 80s, 99% of our 75-year-olds, and 77% of our 70 to 75-year-olds. That equates to 138,000 total doses delivered, and 128,000 of those are first doses. And I would stress that those figures are those which have been released publicly yesterday afternoon, and they will have moved on, as particularly in the cohort of the 70 to 75s, quite considerably since that time, as we focus on that cohort this week. The key part of this is that, of course, the mandate that we're working to deliver is to offer the vaccine to all of those members of our community by Sunday, and we're absolutely on track to do that. So there are a number of key messages that I'd like to give. The first is that, of course, our population has a choice. They have a choice to attend the vaccination centre at Moulton Park, and they have a choice, if called by their GP, to accept that too. And it's very important to stress that, because local services have been the mainstay of how we've delivered our performance so far, working in partnership with our colleagues in primary care. And having that choice means that patients can either be vaccinated within one of their GP surgeries close to their home, or if it's more convenient, they can, of course, come to the vaccination centre. The other very important message is to repeat that which was given at one of the Downing Street press conferences, which is if you're aged over 70 and you haven't yet heard, for whatever reason that might be, from your general practice, or you haven't taken up the offer that's been made so far, you can absolutely still do so. You can still do so well into the future, but there is capacity for us to be able to deliver your vaccine. All you have to do is ring 119 to access the national booking service, and we will be able to offer you that without delay. Our general practice colleagues are still calling patients and will be undertaking vaccinations throughout the weekend, and the vaccination centre, of course, will be open too. So we are focusing very much on the age cohort of 70 to 74, because that is the one which came in slightly later than the other two. And we're working very hard to focus also on the care homes and those members of our communities who are housebound and therefore clearly unable to come to some of our services. And those visits continue now, they'll continue over the weekend and indeed into next week to ensure that we offer as many vaccines as we possibly can. Next week, we anticipate we will start to focus on other cohorts, but that has yet to be announced formally. But we are ready and prepared to move through the cohorts very much in line with what the Secretary of State has laid out his expectations for the NHS. So I'll pause there and I'll answer any questions when we come to them. Thank you, Councillor Morris.
Thank you, Chris. As always, some very good stats there. I think we can safely say that our vaccine programme to date is going extremely well, and we should be very proud of the system that's been put in place across the county with all the partners that have worked so hard to make that happen. It really is amazing to see those numbers, and I'm sure they're still in the top 1 or 2 or 3 or thereabouts in the country. Not that we want to be competitive, but it's good to see that we're doing so well on that. Thank you very much, Chris. I'm going to bring in now Assistant Chief Constable Simon Blatchley to talk about enforcement and any other issues he's had around COVID this week or recently. Simon, good afternoon. Thank you for joining us.
Good afternoon, Councillor. Good afternoon, everyone. Thank you for the opportunity. As ever, in all of the work of our health colleagues and partners with what's being achieved at the moment. So the policing part of this is obviously to focus on the enforcement. All I can do really is echo the comments made by the previous speakers. You know, please follow the rules that have been put in place by the government, the guidance that have been given. Please don't look for loopholes or any sort of way to get around the guidance. This is just to keep people safe. So as a county, we can reduce the levels and we can try and get back to normal. From a policing point of view, we have continued with our patrols, as we said. We do work with our partners. We focus on the key areas this week of Corby, now Kettering, to do some high-profile patrols. The 3 main areas where we're still seeing irregular breaches are the people sort of leaving their home place without a reasonable excuse, gatherings of 2 or more people inside houses outside their bubble, and also not wearing a face covering when they should. These get reported by members of the public into us as the police service, but also when officers are on patrol. These messages have been quite simple really since the beginning of the pandemic, so please don't breach them. We are in lockdown, so please just follow the rules. We'll continue our patrols over the forthcoming weeks as well. Fortunately, as a county, we've had no major breaches this week. We haven't had any unlicensed music events or anything like that to report, which is good news. So, Councillor, that's me. Thanks very much.
Thank you very much, Simon, as always. And I believe that we've got one of the highest rates of enforcement in the country, which is great to see as well. Another part of the system across the county working extremely well together with every other part of it. It's really good to see. So thank you very much, Simon. I know you're very busy. Thank you for joining us. I'm going to now open up to questions that were submitted in advance from the media. We've got quite a few, so we probably won't have time for extra questions at the end. But we'll see how we go. So up first is Laura Coffey from BBC Radio Northampton. Good afternoon, Laura.
Good afternoon, Councillor Morris. I think Chris Pallow, you answered my question there. So if I could ask a different one, it was just regarding what is being done in Corby and Kettering. I mean, we've heard about the additional patrols, but what other measures are being taken? Maybe Councillor Beattie would like to respond to that.
Thank you, Laura. Very, very good question. I will bring in Councillor Beattie, if I may, and then perhaps Lucy may may wish to comment as well, but I'm sure Tom will cover it adequately. So Tom, over to you, sir.
Yeah, thank you, Ian. I mean, there is a similar question, I think, towards the end of the Q&A sessions, but I'm happy to talk about that now. I mean, clearly, we're pleased to see that Corby is no longer the place at the top of the list. We've dropped down that particularly unappealing league table. So that's something, I think, and I think hopefully that the trend will continue to move in that direction. However, there is still concern, as Lucy pointed out earlier. Infection rates are still high. They're high across the county, but they remain stubbornly high here in Corby. What are we doing? Well, we're doing a number of things. This week, we've just agreed, for instance, to and approved a booklet, an 8-page booklet, which will be distributed to all Corby households with some pretty hard-hitting messages. I think some introductory words from both myself and from Lucy as Director of Public Health, and reminding people of what they need to do in terms of their own personal behaviour. So that will be landing on people's doorsteps from the beginning of next week. It's already on our council website, so people can access it on the website. It's out on social media fields such as Twitter and Facebook, etc. So that's one thing. Our environmental health officers have also written to all businesses here in Corby. Again, one of the concerns that I've expressed and expressed constantly for the last few weeks is the what I see as the risk involved in the work that goes on around all of the industrial estates in Corby, where a lot of people are unable to work from home because of the nature of the work they do. We've had a couple of small workplace outbreaks. We want to ensure that businesses report them to us as soon as they happen. So they've been written to by our environmental health officers to do that and bring that to our attention. So we're continuing to do all the things that we've been doing for the last few weeks, indeed months, and that's trying to assist where we can with advice, support, and guidance, both to individuals and organisations who need to continue to working alongside the police to enforce that where that needs to be enforced, and so our environmental health officers, COVID marshals, whatever they may be called, are doing that and will continue to do that. There's quite a bit of a ramp up, I think, in terms of public messaging over this week, and we'll see that next week as that leaflet begins to arrive on people's doorsteps. And publicly, I've done a number of radio and television interviews over the course of the last week or two, trying to continually push that message home. I'm pleased, as I said, Lucy's presentation earlier has showed that things are beginning to move in the right direction. That they're still not moving as quick as we would want them to, but with the adherence to the guidance that we've issued, the strengthening of that messaging over the next week or so, I'm hopeful, cautiously optimistic that we'll continue to see those figures go in the direction we want them to, i.e. in a downward direction. Thank you, Ian.
Thank you very much, Tom. Lucy, did you want to comment on that question?
I mean, I think Tom summarised it beautifully. You know, we've got a number of sort of streams of work going on around enforcement and compliance, around support for businesses and individuals, as well as sort of social media and media increasing sort of presence and messaging that is Corby specific. So we've got many more paid for services, for example, that are specific to Corby geography rather than county-wide. The other thing to add is that we're making sure that we've got as many of those resources translated, so that people who are attending, for example, the lateral flow testing sites do fully understand the requirements and that the restrictions still apply to them once they've had those tests. And we have got campaigns that obviously are county-wide, where we're focusing initially on Corby as well, such as the community ambassadors. So again, we've got people who are now reaching into community leaders and working much more with hard to reach populations to make sure that, again, people understand not only the services that are available to them to keep them safe, but also their responsibility on an individual level to contributing to the continued downward trend, as Tom says.
Thank you very much, Lucy, as always, and thank you, Tom, for that. And thank you for the question, Laura, a good one. I'll move on to Kevin Nichols from the Chronicle and Echo. That's the Northampton Chronicle and Echo. Kevin, good afternoon, sir.
It is indeed the Northampton Chronicle and Echo, Ian. Thank you very much indeed. The one and only. Thank you. I'd just like to ask about the vaccination progress of vaccinations in care homes. I think the government made a big announcement, called it a major milestone, about a week and a half ago, saying that all care homes had been offered vaccines. I think this sort of created an impression among some that the job was done. And there are some out there who have contacted us and others that they haven't had vaccines yet. I just wonder if we could get an update on the progress of how that's going and what proportion of care home residents have been vaccinated already, how many there is to go, that sort of thing.
Thank you, Kevin. I'm sure Chris alluded to that in his opening statement a bit as well, I think. But we'll come over to Chris, who no doubt can answer the question. Chris.
Yes, thank you, Councillor Morris. Afternoon, Kevin. So will it be over? No. So it's going to be a rolling programme of taking care of those in care homes in the county, because by very nature of the patients and residents they care for, there is a fair turnover, and so we need to ensure that service is ongoing. We are continuing to vaccinate those in care homes. We're doing that over the weekend. We're doing that into next week, and we have visited very many of them around the county. The key word in there is eligible, and there are some reasons why care homes wouldn't be eligible for vaccines at a particular point in time, and that is usually because they've had an outbreak of COVID. And so we need to wait for that outbreak to pass, and we work very closely with our colleagues in public health at NCC, who undertake an assessment of when it is safe and appropriate for both the residents and the vaccinating teams to go in and to vaccinate them. And that's why it's a rolling programme, because when outbreaks are finished, we will then send our roving team in to vaccinate. So hopefully that answers the question. I don't know if Lucy wants to say anything else, Councillor Morris, but hopefully I've covered.
No, I think you've adequately covered the answer to that question very well. In fact, not adequately, that's completely the wrong thing. You've very well answered to, as always. Kevin, thank you for your question.
Thank you. Thank you, Ian.
I've got a question.
Thank you, Chris.
Thank you very much, Kevin. I've got a question from Logan McLeod now. Logan, are you there?
Hi, Ian. Logan's not logged in, but it's Carly Odell from the Cron. I am happy to ask the question. However, I know that he was in contact with someone from Urgent Comms, and I think they were sending over a statement, but I can ask the question if we want to do it on here, if that's easier.
Yeah, well, I was going to read the statement out actually, because I thought that would be important to share the statement. So if you ask the question, I will read out the statement. Thank you.
Yeah, so it's just around the EHO markers, getting reports of them receiving abuse in a similar way to that of hospital staff. Yeah, just kind of what support is being given to them, and what would Lucy and others say to those who are doing it.
Thank you very much. I'm sure that others will add to this, but I will read out the statement that as the County Council are putting out, if we haven't already. So I'll read it out. We haven't had any specific reports of COVID deniers causing issues with our marshals. We were one of the first counties to implement marshals in July last year, and have fully trained staff who are supported with ongoing training as well as risk assessment sheets. Marshals can be found across all districts and boroughs and work alongside special constables and EHOs as part of a joint enforcement team in a variety of locations around Northamptonshire, including the vaccination centre. There are daily meetings as part of this joint enforcement to coordinate responses and to deal with intelligence, including any issues with the general public. These are passed on to us in the local authority, as well as to police colleagues. Marshals are supported to report issues, no matter how small, using their online forms designed for this process, and they can also email issues to their manager, which would then be passed on to the team at the County Council. Our marshals are doing important work gathering intelligence and offering advice to the general public. Abuse of any person doing their job, in any job, never mind the marshals, is not acceptable, whether hospital staff, emergency services or marshals. And we would of course ask that the general public allow them to carry out their roles free from abuse. So that's the written statement. Thank you, Carly. I did want to bring in Simon, I think from the police, so he may have further comment on that. And then maybe if Lucy wanted to come in, she may wish to. Simon.
Yeah, thank you, Councillor. Just to completely echo the points you've made, we had 2 instances this week where police officers were verbally abused, one to the extent that the individual was arrested for Section 5 public order and we dealt with. And we will enforce on this robustly if people are abusive to marshals or emergency service workers, because behaviour is just not acceptable at all. So we will deal with these. Thank you, Councillor.
Thank you very much, Simon. I don't think we need to bring Lucy in on that one. Excuse me. So thank you for that question, Carly. Well, thank you, Logan, via Carly, for that question. Very useful to reiterate our support for our staff and particularly the marshals in these difficult times. So we go now to some global media group questions. As always, I read these out because they don't attend the meeting. So the first question is to Lucy Whiteman, and the question is, after Peter Bone MP asked the Health Secretary about the possibility of mass testing in the COVID hotspot of Northamptonshire, and Mr. Hancock's response that he would investigate, have you had any direct comms from Mr. Hancock or his department? And what do you make of the suggestion of mass local testing akin to the Liverpool model? Thank you. Lucy.
Thank you, Councillor Morris. So I just want to be clear, Northamptonshire is not a hotspot. We do obviously have a higher than desired rate in Corby, but Northamptonshire as a whole area is not a hotspot. So I do want to make sure that people aren't alarmed by that. Secondly, we do already have a lateral flow device, so asymptomatic testing centre in Corby, and that obviously complements the long-standing local testing site that is Peak for PCR testing. So we have significant coverage in the community already. We also have a couple of large organisations who have already started to roll out lateral flow device testing within the organisation to their workforce. And obviously we welcome the government's announcement that they will be supporting all businesses who have 50 or more employees to be doing lateral flow device testing as well through a central model. So that is all very welcome. So at this point in time, bearing in mind we've talked today about the improving position, it's not generally felt that this is a requirement locally, and that actually we want to make sure that we're maximising all of the capacity that we currently have in Corby as that current hotspot area, and we're seeing the benefit of that being utilised as we stand.
Thank you very much, Lucy. And then there is one to Simon from the police. Northants Police this week have put out messages about people using distraction methods to steal both cars and puppies when prospective buyers turn up to inspect the goods. With associated messages about being extra careful, yes, that doesn't make a lot of sense, but anyway, but shouldn't the police be discouraging these sales because surely these criminals are not conducting an essential journey under current rules? Sorry, that wasn't very well written question, I do apologise. But Simon, I think you've got the gist of that one, Simon.
Yes, thank you, Councillor. To cover those points, people being careful when they buy anything is a consistent message that we put out about prevention, be it a vehicle, be it a puppy or anything else, to be sure the person's buying it, that you're buying it from. The issue around puppies and dogs has been particularly live on social media. Just to give a bit of background, we've had 5 reported thefts since the beginning of the year, 3 of them sort of where the dog unfortunately was stolen and 2 attempts. Within the legislation, there is an exemption if you're purchasing a puppy from a registered dealer, a registered breeder. that is exempt, but again, that is only for the delivery or the collection. We really encourage people, first of all, absolutely is essential anyway, but also if you do, all the contact should be virtual online rather than visiting in person. Yes, it can happen, but at the moment we recommend only if it's absolutely essential. And on that broader picture, of course, we are getting that general social report now. Some puppies are now being released and people can't cope with them. So please think twice before you make that decision. Thank you.
Thank you, Simon. A very good message there. Thank you very much. And thank you for those questions from the Global Media Group. We move on to the Northampton Telegraph now, and Alison Bagley. Good afternoon, Alison. I think Chris may have touched on a bit of this in his opening statement, but feel free to ask the question.
Yeah, he did. He did say that in his opening statement, but I had a phone call this week from someone in Desborough who was told to go to Corby to get their vaccination. And then he said he couldn't do that because he didn't feel able to drive because it was snowy. And then he phoned back again and said, to the GP, and they said, can you go to Malton, which is obviously much further. Now he's shielding, he doesn't have any family, he's on his own. What does he do? What's the advice to him?
Thank you, Alison. A very good question. Chris, over to you.
It is. So if that person is registered with the GP in Desborough, then the hub that they are working from is at, did you say Corby? I think you said.
Yeah, Woods End.
So yes, it is at Woods End in Corby. So the alternative, of course, is, and as I said at the start, every patient does indeed have a choice. And that is to go to whether GPs are offering the service, or to Malton, or to choose to wait. Now, if that person is shielding, then they are in the priority lists, and I would encourage them to make every effort to attend. If they need assistance to attend, then we can help that too. The most important thing is to stress 2 points. Firstly, when you're called, please do take that offer, because it's so important for us to be able to support you to get your vaccines. Secondly, is that we don't stipulate there's only one choice. And lastly, if for whatever reason the patient can't make their appointment, they can still come back at a later date, either by ringing that number I quoted or talking to their GP. So there are a range of options available.
Mm-hmm.
Thank you very much, Chris. Alison, you had a couple of other questions.
I did have some more, but they've mostly been answered. But I have got one about the police patrols, if that's all right.
Yes, since you're here, why not? Go.
Very kind. It's about the patrols. How many? You say the high-profile patrols. I mean, how many officers extra are there on the beat, and where are they patrolling? Is it residential streets, or is it shopping areas, or is it industrial estates? Where's this extra high profile going on?
The extra resources is partly on overtime. We supply additional officers. Also, Operation Pallow is the police response to COVID. So, being the number one force priority, the additional patrols are the regular response officers. Neighbourhood officers are dedicated to these across the county. What we have done, working with marshals and the joint enforcement team, is focusing those patrol sort of officers on overtime and the neighbourhood teams on that Corby and Kettering area, or wherever we get issues. Just to give some examples, it may be there's a particular industrial estate, it may be a particular bus route, whatever is identified as an issue is where we're trying to focus those patrols. And then also, of course, when we get calls from the public coming into the control room or virtually on single online home, this sort of, again, we'll focus activity on those. And then we build up a picture both internally with the police, but also with the joint enforcement team, with the analysts there, to actually focus on where we need to be going. So you've got some officers dedicated, but also it's a key function of all response officers out there, be they part of the road crime team or the neighbourhood team, to focus on those areas as well, with if they do have any downtime or if they're actively going to or from another job. Thank you.
Okay, thank you.
Thank you, Simon, and thank you for your questions, Alison. Very good ones, as always. I will move on now, if I may, to Northampton Live and Tom Hitchener. You've got a number of questions there, Tom. Hi. I think a couple of them have sort of been alluded to around Corby. Are you there?
Yes, apologies, Ian. Yes, you are right. I suppose if I just narrow it down a bit, I think you have obviously mentioned it. Sorry.
Oh, I think we've lost you there, Tom. Are you there, Tom? No, it would appear we've lost Tom for the minute. Okay, so what time is it? We've actually got a little bit of spare time. I will come back to Tom in a second, but perhaps if I come to Tom Beattie, since you were possibly going to ask questions on Corby, I'll come to Tom and then Jonathan, and they can just sum up where they think we are this week in terms of overall approach, numbers, etc. So if I start with Tom, if that's okay, and then I'll come to Jonathan, and then Tom Hitchener, if you appear back in, we will come back to your question, but I'll come to Tom Beattie first. Tom.
Thank you. I mean, I have a copy of Tom Hitchener's questions in front of me, which I can refer to if Tom doesn't get back on. But I think I largely dealt with most of them at the outset in answer to Laura's question. I think Lucy also in her presentation, I think indicated the direction of travel in terms of the infection rate here in Corby. So the situation is still worrying. I mean, that's the question, that what is the situation now? Well, it's still a worrying situation. It's improved, and we want to see it continue to improve. I've already talked about some of the things that we've done in terms of ramping up the messaging, for instance, this week and next week, which will drive home in a pretty hard-hitting way some of those things that we want people to do. I continue to argue the case about the nature of the industry here in Corby and the difficulty that presents to us in terms of people being able to work from home rather than go in to work. We're aware of that. We've tried to influence government policy over that, and I continue to make that point that there still is a concern. It's not the only concern, and I think we have been clear in recent weeks to say that it's not just about workplaces. The reason for the increases in Corby are numerous. There's a number of reasons, including that sort of workplace structure that we have here, but also household mixing. Also, I think our geographic location to other areas of high infection, simply the more contagious nature of the newer strain. I think all of that has played its part in what we've seen here in Corby. But I think, the good news is that the message is beginning to get through. We did have a similar situation, if you recall, back in March when Corby was placed on the government watch list. Within a couple of weeks, we were able to come off that. It's taken a bit longer this time, but I think, we can do that. And one of the things that we want to try and avoid at all costs is that when the rest of the country begins to come out of a lockdown, whenever there's a route out of this, that Corby isn't left behind. And I think that was the message has been trying to drive home. Let's make sure we start getting our infection rates down as quickly as they're going down elsewhere. Otherwise, we could find ourselves lagging behind the rest of the country, and no one would want that. That wouldn't be good for public morale in Corby. It wouldn't be good for our economy locally. It wouldn't be good for the health of our residents. So it's important, I think, that we continue to hammer home at those messages, and we will be, as I said earlier, next week we'll continue to do that. Thank you, Ian.
Thank you very much, Tom. And I'll bring in Jonathan now, just to sum up where he thinks we are this week, and perhaps then Lucy could come in very quickly at the end there, because there was one question about the South African variant as well that she could perhaps answer. So Jonathan, over to you, sir.
Yeah, thanks, Ian. I mean, as always, it's been a very informative session, hasn't it? Reflecting on the stats are facts, so we have to use stats, statistics. I think it's really encouraging to see that acceleration in the reduction of case rates. Let's hope that that continues as it is. And you know, we've heard about the enormous progress being made. Very proud of the progress being made in Northamptonshire on the vaccinations and so on. Seeing a decrease in deaths as well is really important. And I reflect on Lucy's point there. She's right. We think of statistics, but behind each there is a person. But perhaps let's turn that round and give us something to celebrate, because what those figures tell us is there are people who are still alive this week as a result of the progress that has been made. They otherwise would not have been. I think that's really something to celebrate positively. They're there for their families and so on. So I suppose for me, it's just thanks again to all the professionals on the screen and perhaps above all the organisations that stand behind them. But thanks also to the residents and the businesses who continue this long slog throughout this long slog to comply with the precautions, the restrictions that we ask them to do, because we really can say that we're making some solid progress now. But there's obviously no room for complacency, no room to relax. The impact of those precautions, the impact of all that work people are putting in is really starting, I would say, to pay off. Thanks, Ian.
Thank you as always, Jonathan. Before I bring in Lucy, I think Councillor Martin Griffiths wanted to say a few words as well. Martin.
Yeah, thank you, Ian. Much has been said by Jonathan and Tom, but I'd also like to thank the media for continuing to get our messages out there. It's absolutely vital. The only way we're going to beat this and get our lives back on track is if everybody follows those guidelines and the rules and the law. You know, this is a dreadful virus. I know only too well by personal experience. It's awful. It's a life changer, and we're only beginning to see the impact of that with regard to long COVID. It's also a killer. All I would say is, if offered the vaccination, please take it. It's what we need to come through this, and we will come through it, and we'll get our lives back on track if everybody works together. And the efforts in Northamptonshire have been absolutely staggering from everybody. Thank you, Ian.
Thank you, Martin. I'll just bring in Lucy quickly to answer the question on the South African variant and to add anything else that she would like to add at the end of the meeting. Thank you, Lucy.
Thank you, Councillor Morris. So from a point of view of the South African variant, as people know, it is a confirmed what's called variant of concern. So it is known to pose challenges should it obviously get a hold of the case rate in this country, and hence the government's significant intervention where those cases are being identified. I'm pleased at this point in time to confirm that we haven't had or do not have at present any South African variants confirmed here. We work very closely with PHE. Any suspected variants are reported very early to us and fully investigated. And as I said, I can confirm that we have not had one so far, and at this point in time, none are under investigation either. Obviously, there are other variants that are what's called under investigation that obviously have been popped up in other areas of the world. And again, we're making sure that we're fully briefed as Directors of Public Health. We also have that weekly call with the Chief Medical Officer who updates us on the position. And again, we've got very rapid notification processes should any of those be identified locally either. What is clear though, as we've talked about before, is we do have the Kent variant that is up to 70% more transmissible. We do know it's having an impact on morbidity and mortality. And it is worth just mentioning when Tom asked about the reasons for some of the challenges in Corby. Yes, it is a lot to do with our population level risk and exposure. And Tom's touched on that again about, you know, just the sheer number of people that need to physically attend work in somewhere like Corby, and I would suggest some parts of Northampton as well, means that people are generally at more risk. But the other thing that is noticeable, particularly in today's report from central government and that list that some people may be able to access around case rates, it talks about the proxy measure, which is called S-gene target failure for the Kent virus. And Corby currently has the highest percentage of its sample that is sent off for this type of testing that identifies the likely presence of the Kent gene out of all of those areas listed on the Chief Medical Officer's watch list. And that's part of the challenge. So we've got a population at greater risk because more of them have to present to work than in a lot of other areas. But then we've also got within that population of those being identified as having COVID, a very high percentage of them being that Kent variant. So again, just reinforces the need for all of those measures that we've talked about, because Corby's not out of the woods yet. We need to keep adhering to those rules and making sure that we don't give the opportunity for further onward transmission at any point, whether in work or at home, please.
Thank you very much, Lucy. And sorry, Tom Hitchener, that if you were cut off there, but I do believe between all those speakers, we have answered your questions. And of course, if
yes,
you haven't.
Thank you. I'll go back in. Thank you. Thank you, everyone.
Are you happy?
Apologies.
Don't worry. These things happen, but I do believe we answered all of your questions. So thank you for those, as always. I think that is probably everything for today. We actually might finish a few minutes early, which is unusual, but
sorry, Ian, there's a question in the chat.
Yes, I've seen the question in the chat, and I think Lucy did allude to the answer to that already, but we do normally ask that the questions are submitted in advance, if at all possible, and I don't think we've got sufficient time to look at that one at this current moment. But what we will do is we will make sure that we answer that question. Yes, if you could follow up with an email, we will make sure that we answer that in detail outside this meeting. Thank you so much for that late question. But if in future people could submit the questions in advance, that would be very helpful, because we can time them in a timely fashion so that we make sure that we answer them. So not that we're avoiding answering them. As I say, we will answer them outside of the meeting. So it remains for me to say thank you, everyone, for coming today. As always, thank you for everyone who attended and took part on the panel. Thank you to the media for the questions and the answers from the panel. Thank you so much. Have a lovely weekend, everyone, as much as possible, and see you soon.